start. First of all, we will start with this PDF, which is going to be very useful, and you can also visit to this, and you can also watch this PDF. So let's learn abbreviation from this PDF. So here, first of all, it is written as AC, that means anterior chamber. Okay, a 1%, that means atropine 1%. There is a dilator. Okay, ACC means anterior cortical cataract or changes that is in the lens. Okay, diagnosis and finding, you need to write ACC. Now ACG, that means angle closure glaucoma. So in case of angle closure glaucoma, shortly you can write as ACG. Now ACIOL, that means anterior chamber intraocular lens, that is ACIOL. So this is the lens, artificial lens that is put. Okay. Now another is that ED, that is amount of plus for reading power. So it is mainly done in presbyopic people where you need to put some addition power. No? And another is AION, anterior ischemic optic neuropathy. That is an optic nerve or optic disc pathology. Okay. ALT, that is argon laser trabeculoplasty, that is used in glaucoma procedure, laser procedure. ARMD, age-related macular degeneration, that is in retina diagnosis. Instead of writing those long name age-related macular degeneration, you can write as ARMD. Okay. Another is that APD or RAPD. APD means afferent pupillary defect, and RAPD means relative afferent pupillary defect. Okay, that is very much useful to see in a type of optic nerve pathologies also. Okay, now ARX, that is auto refraction, that is in refraction purpose. You need to, if you are sending your patient to an or for auto refraction or auto refractometry, you can write ARX. Now AT, that is artificial tear, preservative free artificial tear, that is PFAT. Okay. Now AV is the anterior vitreous. Now sometimes it is needed in case of what to say synechiolisis or this type of conditions. Uh, Many times the consultant do anterior vitrectomy. Okay, so anterior vitreous, posterior vitreous. There is different names are there depending on what part it is of the vitreous. AV, anterior vitrectomy, that is AVX. Now AX, that is the axis. BCV, that is the best corrected visual acuity. Okay. Now let's move here. The BDR, what is it? Background diabetic retinopathy. That is also known as NPDR, non-proliferative diabetic retinopathy. Okay, that is BDR. BK, that is band keratopathy. So let's see how band keratopathy looks like. Okay, that means so that you can learn easily. Okay, band keratopathy. Here it is. So you can see here how this band keratopathy look like. There is a band shape formation is there in the cornea. Okay, so this is why it is called as band keratopathy. In this picture also you can see this band type structure band is forming. Okay, so this is the band keratopathy. Okay, so band keratopathy is a line or band that appear across the center of the cornea, and the cornea is the clear window in front of the eye. Okay, now let's move to another is the BRAO, branch retinal artery occlusion, where due to thrombosis or embolism formation in the artery, there is an ischemic condition of the retina. That is BRAO, branch retinal artery occlusion. Let's see its picture. Okay, BRAO. Okay, so you can see here, this is the BRAO. So why it is whitish? Because due to the thrombosis, this area is having ischemia. Okay, so this is why it become whitish. Okay. Now another is CD, that is cup disc ratio. It is very important in glaucoma diagnosis. So depending on that cup disc ratio, the consultant will diagnose that what is the amount of or what is the risk of developing cupping of the optic disc. Okay. See if there is cell flare. Cells flare are generally seen in uveitis cases or post-operative patients. You can see cells flares, and there is different types of grading procedure there. There is a grade 4, 3, 2, 1, depending on how much amount of cells are present. Now, CA, there is conjunctiva sclera in slit lamp examination. C1, cyclopentolate, that is a cycloplegic drug. CV is the ciliary body. Okay, ciliary body. CV is the anatomy of the eye. CBB, there is ciliary body band. Okay, CBB, ciliary body band. So this is used in case of gonioscopy procedure, where there is first of all Swellby's line is there, anterior trabecular meshwork, posterior trabecular meshwork, then scleral spore, and then ciliary body band. Okay. Now CC, that is with refractive correction, that is CC. Now CCT is the central corneal thickness or pachymetry, which is measured by using that probe that I already uploaded a video over that thing. Okay. Now another is the C, that is cataract extraction, that is a type of cataract surgery. CF, that is counting finger. So if the patient is not able to read the for biggest letter, there is 660 letter on your Snellen chart, then hand movement, and then counting fingers. Okay, so that is the CF, counting finger at now CL, there is the contact lens, soft contact lens, hard contact lens, depending on that thing. This CL, SCL, HCL is the CM. There is cyclomadril, there is dilator. Now CME, cystoid macular edema, it is mostly seen in diabetic retinopathy cases. CNV, choroidal neovascularization in case of retinal diagnosis. And this choroidal neovascularization in sometimes lead to neovascularization of the angle, which can also lead to glaucoma. Now CNVM is the choroidal neovascular membrane. Okay. COAG, chronic open angle glaucoma. So open angle glaucoma, if it is it takes long time, then it is known as chronic. So this is the chronic open angle glaucoma. CPC, that is cyclo photocoagulation, in it is a glaucoma or laser procedure. Okay. Another is the CRAO, central retinal artery occlusion, central retinal vein occlusion, central retinal artery occlusion. So let's show you the picture. Okay. CRAO. So CRAO will look like this. A clean view is there because there is a ischemic condition in the what to say retina. And CRVO. CRVO will look like this. There is a very dot-shaped hemorrhages are scattered all over the retina. So this can be the diagnosis factor that how CRAO looks like and how CRVO looks like. And we will have a separate video on this CRAO and CRVO in the coming days. Okay. Another is that here. This is CRX cycloplegic refraction. So it is mostly done in to find those latent hypermetropia, or in case of children who accommodate and correct the hypermetropic power. Okay, so for that purpose, cycloplegic refraction is done. And this cycloplegic refraction is also very much important in accommodative esotropia cases, where the children who are less than 3 years of age, they can correct their refractive error. It can be 5 diopter, plus 5 diopter hypermetropia, or plus 4 or plus 6. They can correct that hypermetropia with their amount of by inducing the accommodation. Okay, so this is cycloplegic refraction. So for that purpose, cycloplegic drugs are put, cyclopentolate, and then refraction is done. Now, cryotherapy in glaucoma procedure. Okay, this is the cryotherapy. In case of it is mostly done. Cryotherapy is mostly performed in absolute eye. Okay, CSCR, there is central retinal chorioretinopathy. CSCR, it is a retinal pathology. Another is the CSM, central steady maintain. This test is performed in especially for children of age that is less than 6 month of age. So for those babies, CSM is performed. CSME, clinical significance, macular edema, it is a retinal diagnostic pathology. CVF, there is the confrontation visual field. So confrontation visual field is the manual procedure where the examiner will fix your eyes to and fix object in front of your eye at about a 60 centimeter distance, and then he will move a bright color object to the periphery of the eye, and he will ask that at what point you are seeing that. So by this method, the examiner will assess what can be the visual field of the patient. Okay, so this is confrontation visual field. CW is coronal spots. So let's see how coronal spots is look like. Okay, COW, coronal SPO, coronal spots. So look, coronal spots will look like this. It is mostly seen in diabetic cases. Okay. Uh, CW is coronal spots. Yes. CYL, cylinder. SPH is the spherical. CYL is the cylinder. And cylinder is a wing axis. And in the axis, there is no power. In its opposite axis, there is power. Okay. D and Q, that is deep and quiet. That is anterior chamber. Finding. In slit lamp finding, you need to write like this. DMVP, that is disc macula vessel periphery. It is for fundus examination. DELK, deep anterior lamellar keratoplasty. This is the most recent or what to say, a recent procedure to for corneal transplantation, where PK is the full thickness corneal transplantation, but in DALK there is decimate membrane endothelium is remain, and its uppermost layer is that is uppermost layers of the cornea is removed, so cornea will get little strength. Okay, now DBH, dot blot hemorrhage, it is also seen in diabetic retinopathy cases. DF, decimate falls, and DFE, that is dilated fundus examination. DLK, diffuse lamellar keratitis. Okay, so let's see the picture. Diffuse lamellar keratitis. So diffuse lamellar keratitis. Look, so it will be very much helpful for you for a corneal idea, identification also, that how this thing will look like. So These are the things that you will find with the help of slit lamp. Okay. Another is that what to say? Okay. ET, intermittent esotropia, and E, that is the esophoria. Esophoria, phoriatropia. Tropia means that that is seen, that the person is having deviation. And in case of phoria, it is the hidden strabismus, where you need to find out with the help of a alternate cover test. ECC, extracapsular cataract extraction. There is an old procedure of cataract extraction. Now ED, that is the epithelial defect. EKC, epidemic keratoconjunctivitis. Okay, there is a type of corneal pathology. EOG, electroculogram. This is, I think it's a test, but I don't know much about this. EOM, extraocular muscle, ERG, electroretinogram. Okay, and here ERM. ERM is basically seen in retinal cases where there is ERM formation. There is the innermost, I think there is an innermost layer like ERM formation is there. So in case of OCT, by performing OCT, you can easily find out that the ERM is there or not. So ET, there is a esotropia. F plus, fixing and following, that is also an examination procedure for children. FANG, that is the fluorescein angiography. Focal laser in retina. I think in macular disorder, this focal laser is used. So, GCA, giant cell arteries, neurodiagnosis. I don't know much about it, but you should know what is the short form. GVF, there is a Goldman visual field. Goldman visual field, that is also, I think, it's an old procedure to find to measure the visual field, because nowadays it is Humphrey visual field analyzer is mostly used. HA, homatropine, it's a dilator drug, yes. And HM is the hand movement. That means that I already said to you that if the person, if your patient is unable to read the 6 by 6 60 letter, 6 by 60 letter, then first of all you need to you need to test hand movement and ask the patient whether he can see the moving hand or not. And if he say that yes, there is a moving hand is there, I can um, understand that something is moving. Then you will put your fingers and ask how many fingers is there. So first of all hand movement, then counting fingers. Okay, and HOT, hypertropia. HT, hypotropia, HOT, yes, okay. HBF, Humphrey visual field. There is different types of procedures are there: 30-2, 24-2, 10-2, and in this procedure there is several point patterns are also available. So in case of neuro ophthalmology, 30-2 is performed. In glaucoma diagnosis, 24-2 is mostly performed, and in case of macular pathology, 10-2 is performed. I is the iris. ICC, there is also an old procedure for cataract extraction. Now it is phacoemulsification is done, and also most cases in India, SICS is also performed. Now, IK is the interstitial keratitis. IO, inferior oblique. ION, there is ischemic optic neuropathy. Intraocular pressure, IOP. Okay, fine. Mm, so here, KC, keratoconus. KC is keratoconjunctivitis sicca. KP is the keratic precipitate. So let's see those KPs, how it looks like. So you can see these are the KPs. So it's also diagnosed with the help of slit lamp examination. So keratic precipitate is an inflammatory cellular deposit seen on the corneal endothelium. Okay. L is the lens. LAG, lead lag. LASIK, laser epithelial keratomylosis. LASIK is the most widely used refractive surgery, where laser is used by making a flap, and also a laser used to change the curvature. So it is mostly performed in high number people who want to avoid their glasses or who want to drop their glasses. LCL, Leber congenital amaurosis, neuro ophthalmology diagnosis is that. Levator function, LV. So it's I think it's levator palpebrae superioris. So that is then the muscle helps in elevation of the eyelid. LHON, liver hereditary. It is all are neuro findings, neuro ophthalmology. LPI, laser iridotomy, laser peripheral iridotomy. So this laser iridotomy or laser peripheral iridotomy, this procedure is performed in case of closer angle glaucoma, where there is an obstruction of the aqueous outflow is there. So laser is used to make a small hole so that aqueous can get pass through it. LPC, projection, that is light perception with projection. Okay, now LR, lateral rectus. MG, that is myasthenia gravis. MGD, meibomian gland dysfunction, which is a reason for dry eye. MGP, that is meibomian gland plugging. You can also see this PDF that I will give this the link of this PDF so that you can access these things. Okay, MR is the medullary rectus, MRD, MRD2. These are used in um, ptosis grading. MRX, manifest refraction, MS, multiple sclerosis. NVA, neovascularization of the angle that I already said. NPD, neovascularization of the disc. NVE, neovascularization elsewhere. NVG, neovascular glaucoma. So this NVA leads to NVG. Okay, NVA, neovascularization of the iris, that means in the iris you can see blood vessels. OCT, NFL, nerve fiber layer. It is also used in glaucoma diagnosis. OCT, optical coherence tomography, which is based on interferometry, where it is where constructive and destructive interference is there, and depending on the hyperreflective and hyporeflective, so that you can understand different layers of the retina. OD is the right eye, OS is the left eye, and OHT, ocular hypertension. PAS, peripheral anterior synechia, that is seen by gonioscopy, peripheral anterior synechia. PBK, pseudophakic bullous keratopathy. PCO, posterior capsular opacity. PDR, peripheral diabetic retinopathy. PDT, that is photodynamic therapy, that is a retinal procedure. Okay. Now, PK, penetrating keratoplasty, full thickness, corneal transplantation. PKP, penetrating keratoplasty. Okay. SPH, that I said, sphere in refraction. CYL, cylinder. SPH, spherical. SPK, superior punctate keratitis, which is due to dryness of the eye. So, in this type of cases, patient is given lubricating eye drops. Okay. SS scleral sport. T is the tonometry by which you can measure the intraocular pressure of the eye. So, one most widely used tonometer, Goldman attenuation tonometer. TM is the trabecular meshwork. Uh, XT, exotropia, and X is the exophoria. Okay. Another, I am having another abbreviation here. So here you can see these abbreviations, that QD is once a day, BID twice a day, TID thrice a day. Okay. Now QID 4 times a day, QHS bed before bed, Q4H every 2 hours. Now if in place of 4 it is given Q2H every 2 hours, Q13 min, that is every 13 minutes. Okay. PM is as needed. Okay. And QTT is a drop AC before meal. Okay. So these are also intramuscular, subcutaneous, intravenous. So these are the procedure how to put the injection to the patient. Okay. So that's all, friends. Thanks for watching. Please don't forget to like my video, subscribe to my channel, and I will put this website on the description. So don't forget to go to this website and read those abbreviations and memorize it as soon as possible as you are in clinic. So it's very important to use these abbreviations to